Yeah, I've got some questions here for from Reddit and our Facebook group. So if you're listening and you're not in our Facebook group, I encourage you to join. It's Testicular Cancer Support Group. So this person asks three questions. We'll go one by one. How do we manage the concerns of fear of getting too much radiation from surveillance scans and needing to be on surveillance? Is there anything we can do to limit the exposure to the radiation?
Yeah, so that is a really great question, and it comes up in clinic increasingly often now, and that's because of awareness of this concept, and kudos to the internet, social media, everything for increasing awareness. And what the question is getting at is that CAT scans, CT scans, come with a admittedly very small, but a small dose of radiation. And over time, over our lifespan, the amount of small radiation we get, including like when you fly on an overseas flight, you get a small dose of radiation. We all have like small doses of radiation in our basement from radon and things like this. So the cumulative exposure in life adds up. And we believe, and a lot of this is data that's been extrapolated from, for example, Hiroshima and other nuclear events, where we believe that the cumulative amount of radiation you get in your life can lead to the development of a second cancer. So not the testis cancer coming back, but like another cancer, a blood cancer, or another solid cancer. So the essence of the question there is, okay, you got diagnosed with testis cancer, and now you're going to get CAT scans at a regular interval. Are you harming yourself by getting these CAT scans? That's the essence of the question. And the answer is there's basically three ways to minimize the radiation from your testis cancer surveillance. One is to minimize the number of CAT scans you get. And I have to say, at Princess Margaret, we've worked hard to over the years, we've reduced the number of CAT scans that we use. And we've looked at our data, and it's our reduced number is totally safe, doesn't increase the risk of missing cancers and whatnot. So you want to talk to your physician to say, are we following the right schedule so that we're using the least number of scans and still catching the relapse safely? Two is minimizing the dose of radiation of any CAT scan you get. So we created this what we call low dose CT protocol at Princess Margaret, and we studied it, showed that it was just as good as the regular dose, and we published on that in 2008. So every single one of our surveillance scans is with this low dose, and it cuts the dose in half. And then the third is avoiding CAT scans altogether, and that's with MRI. You still need to have some imaging of your abdomen, and we now have data, and it's a little bit tricky to know how to interpret it and apply it to everybody. It's from seminoma, and so whether you can apply it directly to non-seminoma is tricky. But the MRI has no radiation. It still gives you contrast, gadolinium contrast. So there's pros and cons of both, but that's the third way is not getting CTs at all, but MRIs.
So you bring up MRIs and CTs. Sometimes people mention PET scans. So I mean, you touched on it a little bit there, but why would somebody get a PET scan versus an MRI or a CT?
Yeah. So there's also something that we see quite commonly. So I think we should be clear that there's really no role for PET scans in testis cancer in any setting other than seminoma that has had chemotherapy, and you're trying to see if there's residual disease left over after your chemotherapy. And even then, not every case should get it. There's some specific criteria. If your mass is greater than 3 centimeters, for example, and if you're enough, time out from chemotherapy, we don't have to get into the details of that. But really, that's the only time PET scan has a role. Otherwise, for testis cancer, you can find everything you need from CT, tumor markers, the occasional MRI for your brain, for example, if your clinician is worried about that. But PET scan really only serves that role. We see all too often PET scans are ordered for staging, or PET scans are ordered, on surveillance, and there's more radiation associated with that, and it sometimes can give you false positives, meaning there's stuff there that actually isn't there. And it could also give you false negatives, meaning it calls a mass negative, but in fact, that's a teratoma, and that needs to have surgery. So it can reassure you inappropriately both ways.
Interesting. All right. So we kind of touched on this guy's third question, but his second question was, are there any proven or studied tactics we can use to mitigate or combat the negative effects of scans before, during, or after?
Yeah, I mean, Not really. I would say short of, you know, so you get if you're getting IV contrast, for example, I mean, the principle is to stay hydrated. If you're diabetic and you're taking metformin, you should talk to your doctor about stopping the metformin before you get the contrast. But there's really nothing you can do. There's no diet or hydration to mitigate the effects of the radiation. It'll be what it'll be no matter what your current state of your body is in. So the contrast is one thing, but for most young, healthy guys, whether you hydrate or not, very few of you will be on metformin anyway. So there's really not much you can do to mitigate the effects. Again, it comes back to that minimizing the number and the dose of radiation.
For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org.